Nursing 431, Nursing Research and Healthcare Economics. The course learning outcomes include develop a proposal for a project that will resolve a problem in a professional work area, integrate knowledge from other disciplines when utilizing the nursing research process, articulate the role of nursing research within clinical practice and explore the components of the research process, apply critical thinking when relating nursing research to practice, and lastly, recognize the value and relevance of research in nursing to the development of one's own professional practice and to the quality of patient care. The weekly learning outcomes include describe methods of presenting research, recognize barriers to nursing research utilization, discuss measures to facilitate nursing research utilization, discuss impact of economic issues on nursing research utilization, and lastly, prepare research proposal presentation using PICO question. Nurses must attempt to quantify their value in monetary terms. A firm produces a good or service, for example, treating patients, using what economics call a production function, or the output that can be produced within a given set of inputs. In economic terms, we say that firms have a derived demand for labor because the demand for labor is derived from the demand for the product or service that the firm produces and sells. The marginal expense of a worker is the additional cost of hiring one more worker. Usually, the marginal expense of hiring an additional worker is the market-determined wage rate. The exception occurs when a monopsony, a large buyer of an input, such as the only hospital in town, sets the wage. The marginal benefit of a worker has two components: the marginal product of the labor and the marginal revenue. The law of diminishing marginal returns based on empirical observation says that as more of a variable input, such as labor, is hired and the amount of capital is fixed, the more the marginal product of a worker declines. Primarily due to this diminishing marginal product, the demand for labor curve is downward sloping. The steps to determine the optimal combination of all inputs is somewhat complex, but essentially the marginal benefits need to be compared to the marginal expenses. Nursing is an admirable profession, but is also a business. Nurses should be familiar with economics in order to demonstrate their value in monetary terms. It is very difficult to see the output of a nurse's job because the output is ultimately measured in terms of the health of the patient. Ultimately, nurses are an input used in providing health care, so there is a derived demand for their services. There are many factors that affect the supply and demand for nursing services. The demand for nurses is expected to increase as the demand for healthcare services increases. This will occur as the baby boom population ages, as medical technology allows more health problems to be treated, and as the consumer incomes increase. The supply of nurses will be affected by many factors. If the wage for nurses increases relative to other occupations, more persons will be attracted to nursing schools. However, if wages in alternative occupations such as engineering, accounting, and finance increase, the supply of students to nursing programs is likely to decrease. One of the major demographic concerns is the increasing age of all nurses. With the demand for nurses expected to grow in the coming decades, there is considerable concern that there will not be a sufficient influx of young nurses to replace retiring nurses. Recently, healthcare economics and nursing experts have begun to grapple with the issue of costing out nursing care. Part of the problem with determining the value of nursing care is that hospitals have not billed separately for nursing services. In the current system, hospitals can make profit in the short run if they increase the workload of nurses. However, this strategy is likely to lead to long-term losses if the quality of care is significantly reduced. Hospitals need to carefully examine the value of nursing care. Brooten Et al. Study on very low birth weight infants clearly demonstrates the cost effectiveness of nursing care. The study examined early hospital discharge and home follow-up care of the very low birth weight infants. The researchers found that follow-up care by a nurse specialist is safe and cost-effective. This type of care potentially reduces hospital care costs, decreases illnesses and hospital-acquired infections, and enhances parent-infant interactions. Ferguson discussed the cost-effectiveness of a nurse practitioner managed care unit that was implemented in the meat packing and rendering plant in the northern United States. During the first 5 years, from 1988 to 1992, a net savings of over $1.3 million was realized in the cost of workers' compensation alone. Greenburg reported the cost savings of telephone nursing in a pediatric outpatient clinical setting. Results of 90 calls were examined. The dollar savings for 1 month was estimated to be $2,360. This figure was determined by subtracting the dollars spent on actual outcomes from the dollars that would have been spent based on outcomes without telephone nursing. Paul, Phillips, Wyndham, and Hollenbeck studied the cost-effectiveness of providing home nursing visits after newborn discharge. Nurse visits to newborns were made 1 to 2 days after their hospital discharge to determine if these visits would reduce the incidence of rehospitalization for jaundice and dehydration. These visits were found to reduce hospitalization within the first 10 days of life and were significantly less costly than were the visits to the emergency department. Research is the means of demonstrating the value of nurses in the United States, the value of nurses in the healthcare arena. Numerous sources call for more research on the economic value of nurses. Chen et al. Have called for future research that validates specific roles and functions of advanced practice nurses in regard to specific quality outcomes and cost-effectiveness measures. Bednarski reported the American Association of Nephrology Nurses supports an evidence-based approach for delineating the value of nursing and wrote that it is critical to connect nursing care with outcomes of this care. Walsh and Brooklyn have called for more research in the use of bachelor's-prepared psychiatric nurses in the role of psychiatric liaison nurses in medical patient care settings. It is quite obvious that more research is needed on the economic value of nursing. It is hoped that young nurses will be more interested in the economic impact of nursing and will be willing to participate in research to evaluate the importance of nursing in the healthcare arena. According to experts, areas that need additional research are how nursing intensity, academic preparation, licensure, certification, and other variables affect care, cost, and quality.